Hello, my name is Ruth Moss Nelson. Today's webinar will talk about healing emotional physical pain through yoga. It is intended to enlarge the scope of practice of social workers and other psychotherapists, to explain the neurology and neuroscience behind why this works, to explain the intersection between physical and emotional pain, and to talk about applications to clinical practices. I hope you enjoy this webinar, and at the end you can connect to links toward actual physical practice that will include credit for continuing education. Enjoy. This presentation is Healing Emotional and Physical Pain, presented by Ruth Moss Nelson. We're on the cusp of a new era in the medical and mental health professions. Holistic mental health care is becoming very well known, much like integrative medicine is becoming well known within Western medicine. There's a groundswell of pent-up demand to include mind-body studies in the treatment of physical and mental ailments. As social workers, our success as a profession will depend upon us becoming informed about and educated and trained in mind-body techniques that can be integrated into our scope of practice with proper education and training, and to be implemented within a clinical setting. My name is Ruth Moss Nelson. I'm a graduate of Wayne State University School of Social Work. After 33 years of employment, I retired in 2010. I practiced 25 years of yoga and became a yoga teacher in 2018. My professional experience is within special education and mental health settings as a social worker. I did not use yoga in my practice. And that's pretty unfortunate because I have found yoga to be a very transformative experience and beneficial to me mentally, physically, and spiritually. I have a better relationship with myself as a side effect of regular yoga practice. And I really wish I had had this knowledge when I was working with clients. A proponent of yoga as a treatment tool has been the Veterans Administrations. Yoga has been a very effective tool to help veterans recover from post-traumatic stress disorder, and is part of the inpatient psychotherapy plan of many VA hospitals. A colleague of mine who works for the Macomb Veterans Center was sponsored by the Veterans Administration to get a yoga teacher training certificate, and they even bought her equipment. Schools are beginning to look at yoga as an option for students to learn self-regulation tools, as well as just to develop their own emotional control, self-control. Bessel van der Kolk puts it this way: self-regulation can be taught to many children who cycle between frantic activity and immobility. In addition to reading, writing, and arithmetic, all kids need to learn self-awareness, self-regulation, and communication as part of their core curriculum. Just as we teach history and geography, we need to teach children how their brains and their bodies work. Being in control of ourselves requires becoming familiar with our inner world and accurately identifying what scares us, upsets us, or delights us. There's nothing better than children learning this in real time while they are developing. Yoga has been an excellent rehabilitative tool used on a limited basis in prisons. The Prison Yoga Project out of San Diego trains all around the world. In some prisons, yoga has been made a part of the rehabilitative process, perhaps even providing the building blocks for emotional and social development and impulse control. Unfortunately, I did not learn this as a social worker. We had a very cognitive top-down approach. Psychodynamic theory, learning theory, cognitive behavioral therapy. The problem is that they were no match for the challenges that I faced, especially in the psychiatric settings, where my clients were in a permanent state of fight and flight, or out of touch with reality. My training pretty much taught me to deal with this kind of a client. What's missing in this picture? Of course, the body. So I had a lot to learn on my own. Social work school taught me only the rational, intellectual problem-solving approaches. And what was missing was the bottom up, tapping into the body as an ally to heal the mind. All aspects of our physiology are intertwined with our body and our mind. Our moods are dependent upon the hormones, neurotransmitters, our nutrition, our microbiome. Actually, most of the transmitter serotonin is made in the intestines. Our stress and relaxation responses are part of the autonomic nervous system. The sympathetic nervous system is the stress response, while the parasympathetic nervous system is the relaxation response. The effect of the stress response on the sympathetic nervous system plays havoc with our skin in the form of hives, reproduction in terms of infertility, our immune system in terms of immunosuppressant disorders, skeletal, back pain, muscular, we can have knotted muscles, cardiac, heart disease, the circulatory system, hypertension, which leads to stroke, the respiratory system, leading to hyperventilation, voice problems due to constriction of larynx, the endocrine system, with hyperthyroid or hypothyroid, cortisol and norepinephrine can wreak havoc on a person when they're exposed to that for a long time. Digestive system, we see ulcers and stomach aches. In my professional experience, in 1988, I worked at Fairlawn Center for adolescent girls as a psychiatric hospital. And one of my patients developed severe hives, and they could not find any kind of allergies that were causing this. And so it was surmised that it was her stress and how it was manifesting in her skin. So what does the stress response do? It affects how we perceive the world. Take, for example, my first experience with my first patient at Fairlawn Hospital. I was very excited. I was a new psychotherapist, and I was told that Virginia, not her real name, was my first new patient. I walked over to her and I introduced myself. And I said, "Hi, Virginia, I'm Miss Moss. I'm your new therapist." And her response was, "Fuck you." And she scooted away. I was absolutely shocked. I'd never been talked to like that. And unfortunately, it never got any better. I had no tools, and my winning personality didn't work in this circumstance. But I wasn't alone in my limitations. Just about everybody that worked there was in the same boat, except the recreational therapist, who worked with the mind and the body by doing real-time activities. She was able to form a relationship with many of these girls. So since 2014, the National Association of Deans and Directors of Social Work have recommended that there's a compelling need for social work education to systematically explore and incorporate integrated body, mind, spirit practices into the graduate social work curricula and research. Unfortunately, this has not been taken up on a large scale. There are classes that are here and there within this country. One of them is taught by a woman named Caitlin Brown at Wayne State University. There's a class at the University of Denver as well in mind-body studies, but for the most part, very little exists, even till today. Now, the medical world has woken up to mind-body medicine, with integrative medicine becoming very popular. And they have endorsed the ancient wisdom of mind-body philosophies, one of which is yoga. So you will see mind-body work being done all over. For example, at a Beaumont Hospital, they have an integrated medicine unit that includes yoga and mindfulness. So let's talk about yoga. What is yoga? Well, the word yoga actually literally means to yoke the body with the mind. It is a 5,000-year-old tradition. It's a philosophy. There is no deity. It predates Eastern religions. There have been references found in the Vedas, which is an ancient body of work written in Sanskrit. A man named Patanjali compiled the Yoga Sutras around the year 400 CE, describing yogic positions plus the moral and ethical rules of living. The yoga that we are actually doing today was muchly devised after around 1900 by a man named Krishnamacharya, and has had disciples by the name of Iyengar or Pattabhi Jois, who have come to teach yoga to the rest of the world. The yoga that we do today in the United States and around the world are basically branches of these disciples. Iyengar yoga is known for its alignment and its adaptability to all levels of physical conditions. So pretty much anybody can do yoga if we modify the poses to fit their body. But again, yoga, the word yoga means to yoke the body with the mind. That is the essential idea of the mind-body studies. There's a few philosophies that I find particularly helpful in yoga, and one of them is in holding space. The people in pain mainly need a witness and a safe environment to discover their own answers. It's the journey. Allowing them to find their own answers is just part of the process. Doing no harm is another very important rule, and that includes not harming yourself. So that's been translated into honoring yourself, honoring your body, honoring its messages. And finally, the concept of non-attachment to worldly things. That really what's important is not what you own. We can be overly devoted to material things and forget what's really important in life. So to experience what it feels like to yoke the body with the mind, let's do a short meditation with Nadia Narain's script. This can be found if you were to Google Yoga Journal, Nadia Narain, 5-minute grounding meditation. Come to a comfortable sitting position on the edge of the chair, the soles of the feet flat on the ground. If you're comfortable, you may close your eyes. Hands resting on the thighs, palms facing down. Lift the spine and roll up from the lower back, the middle back, and the upper back. Allow the shoulders to relax. Feel the crown of the head move away from the seat. Feel a broadening from collarbone to collarbone. Chest is nice and open. Create a little bit of space between the lips and the teeth. The jaw is softer. Feel the breath as it moves in through the nose and out through the nose. Breathing in and breathing out. Breathing in and breathing out. Make your exhalation slowly and completely. Check in with your posture. See if you can keep the spine straight. Pay attention to your breathing as it moves in and out through the nose. Just notice if you've allowed your mind to wander, if you're thinking, and become aware of your thinking, and see if you can bring yourself back to your inhale and your exhale. Breathing in and breathing out. In the next few moments, see if you can allow your mind to rest on your breath. Check in with your posture. Feel your breath as it moves in and out through the nose. Notice if a thought arises, allow the thought to finish. And see if you can bring your attention back to your in and out breath. When you are ready, deepen your breath and make a quiet but audible sigh as you open your eyes and bring movement back into your body. And now you may resume your prior activity with possibly greater focus and clarity. So you may have found something a little bit different with that experience. Perhaps you got a little bit of in touch with your mind and your body together. What we call interoception. It tends to really relax and make one feel peaceful. Feeling alive in your body. Our sense of agency, how much we feel in control of our lives, is defined by our relationship with our bodies and its rhythms. In order to find our voice, we have to be in our bodies, able to breathe fully and access our inner sensations. That's Bessel van der Kolk, MD. So yoga is one very effective tool that can help make this happen. To be in tune with our body and mind is to be in harmony with ourselves. So who are these people? These are neurophysiologists, doctors, researchers, psychiatrists. These are proponents of the mind-body concept. Bessel van der Kolk is an MD out of Harvard University, and he teaches at Boston Medical School. Chris Streeter as well teaches at Boston Medical School and has done research in depression and anxiety, and has found that Iyengar yoga was more effective than a simple walking program when compared to the two. And so she measured the neurotransmitter acetylcholine, which is able to tone the vagus nerve, and we'll talk about it a little bit later. And that is very much implicated in how people experience anxiety and depression. So she found that Iyengar yoga is actually more effective in toning the vagus nerve than just general walking as an exercise. So let's look at the brain. Why is this? What's going on? We start to look at how our brain is structured. This is a very ancient concept, but in 1960, a doctor named Paul MacLean came up with the title of the triune brain, the three-part brain, in which the top section, the yellow section, the neocortex, the prefrontal cortex, are the most recent on the evolutionary scale. And they are responsible for executive functioning, the higher thought processes, like thoughtful analysis, time management, problem solving. And this is where the seat of cognitive therapies lies, such as cognitive behavioral therapy and psychoanalysis. The therapeutic skills taught by schools of social work traditionally address this part of the brain. Now the tan area below that is called the mammalian brain or the limbic system. And this is where our emotions and our instincts lie. This is where our affects, our gut reactions, and our moods lie. And its job is to monitor for danger and help us cope with complex living situations in social networks. It integrates and responds to a wide variety of environmental stimuli, such as smells. Smells really are very, very powerful. The bottom of the brain, the red area, is the brainstem. It's also called the reptilian brain. And it is responsible for our basic life support system, our physiological processes. With the hypothalamus, the brainstem coordinates the functioning of our heart, lungs, endocrine, and immune systems, as well as our energy levels. It's what brings the body into homeostasis, normal functioning. And any disruption here will totally disable us. Now, Bessel van der Kolk calls the limbic system and the reptilian brain together the emotional brain. The emotional brain's job is to look out for our welfare. Depending on what is going on, it triggers our body's organs to release hormones that influence our behavior. It's very important to note that in human beings, the emotional brain overrides the rational brain every time. The emotional brain is highly reactive, it jumps to conclusions, and leaves rational analysis for later, for after the danger has passed. This is human nature. And yet our society is continually surprised when people act in their emotional brain. It's the emotional brain that gets us into trouble when we act without thinking. But it is within our human nature to do so. But there's a silver lining to this cloud, and that is that the emotional brain is directly impacted by mind, body, spirit practices. So this is where the social work curriculum needs to change policy in order to address the emotional brain. So just to review, the rational brain thinks, the emotional brain feels. The rational brain analyzes, the emotional brain reacts physically. The rational brain expresses itself by thoughts and language. The emotional brain expresses itself by somatic body sensations. So if you think about it, if you have a client having a panic attack, how effective can cognitive behavioral therapy be? What we're finding is that the breath practices are a key component to integrating the rational and emotional brains. Medical research is discovering that physiological changes are being prompted by the breath practices, and it opens up all kinds of beneficial mind-body processes. So how are we finding all this out? Through the functional magnetic resonance imaging. The fMRI is to neuroscience what the invention of the wheel was to advancing civilization. None of the amazing information that we know now would be available without the discovery of the functional magnetic resonance imaging. It's like an X-ray of our thoughts. fMRIs are able to use magnets and radio waves to detect changes in the blood flow in our brain. And what happens is that the blood flow and neuron activity go together. So when an area of the brain is in use, where thoughts are going on, the blood flow in that region increases. And it's picked up on the fMRI. And the colors go along with the colors in the light spectrum. Light is the most active, and as it goes down from red to blue to black, the activity level decreases. So yellow is the highest level of activity, brain activity. The fMRI comes into play when we study children and adult brains who have gone through trauma. We have found that the self-sensing areas in the brain get less blood flow, and for that reason, they are actually smaller in size when measured on the fMRI. There are actual differences in the size of the brain regions, such as the insula and the medial prefrontal cortex. Conversely, in people who are longtime meditators, we have found that those areas, the insula and medial prefrontal cortex and other brain sensing regions, self-sensing regions, are actually larger. Also in the brain is the somatosensory system. This is where our mind, our body, and our brain come together. The area that we're looking at is in the parietal lobe. And if you look at the bottom of the screen, there's the two stripes on the brain, and that is the area of the brain, or the head, where a headband would lie. That is the area of the parietal lobe. And this is, the somatosensory cortex system is like a Google map of your body imprinted on your brain, so that we envision our body parts. For example, have you heard of phantom leg syndrome? This is where someone's leg has been amputated, and yet the person feels pain in their leg. But there's no leg. How does that happen? The representation of their leg on their brain is having pain, actually feeling pain. And so it feels as if the leg is hurting. That is the connection between the somatosensory cortex and the body. And this comes into play, especially with chronic pain, people who suffer with chronic pain, because sometimes the pain is actually coming from the brain. We also have found that body movement helps the brain development from infancy to old age. This is the work of Jerry Leishman. And what they have found is that body movement integrates higher level cognitive processes with lower level cognitive processes. Now, in other words, physical movement works to enhance rational brain functioning because movement sparks brain connectivity, the kind of electrical wires that connect neurons and stimulates brain growth. For example, the opposite could be as well true as well, where the rehearsing of physical activity in the brain actually has an impact on the muscle or the output of the muscles. For example, there's a boy who's aspiring to be a basketball player, and he's watching a basketball game on television. And the next day he goes outside and shoots baskets. His skill level will be better in shooting baskets because he had watched the game and watched the skills of the other players. He learned by watching. So there's something that happens by just watching and thinking that it happens into the body, that affects the body. There's a dynamic synergy between the brain and the nerves and the muscles, each helping each other. So looking at the nervous system itself, it consists of the brain, the spinal cord, and then the peripheral nerves. The peripheral nerves are divided into the somatic system and the autonomic. So the somatic nervous system are nerves under our conscious control, such as if you choose to pick up a cup, the nerves that will then fire into your muscles that will allow you then to grab the cup and pick it up. The autonomic nervous system is automatic. It is not under our control. It controls our breathing, how fast we breathe, our blood pressure, how fast our heart beats, how constricted our blood vessels are. This is physiological. And the autonomic nervous system has two branches, the sympathetic and the parasympathetic. So the sympathetic nervous system controls our fight and flight response. It uses adrenaline and epinephrine and cortisol. The parasympathetic nervous system uses acetylcholine and GABA, and it calms us down. But there's also an evil twin to the parasympathetic nervous system. That is the freeze and submit response that we have just discovered recently. And we'll talk about that in a little bit. So the parasympathetic system is what kicks in once the danger has passed and has allowed us to calm down. When the sympathetic nervous system is triggered, the body has an emotional reaction. The emotional brain takes over. The muscles are tensed. The heart beats quicker. Glucose is released into the muscles, away from the digestive tract. Blood pressure rises. Your pupils constrict. And you're just ready to run or fight. You may feel hypervigilant, anxious, angry, defensive. The jaw gets tenser. The hands contract and clench. And you just can feel it. You can just see it in someone. Now, a healthy nervous system is able to flexibly go in and out of the sympathetic nervous response depending on what's going on. They can calm down. However, when someone has trauma, is traumatized, trauma leaves a physiological imprint on the brain. It keeps people in the flight and fight response, even when they're not aware of it. They're tense all the time. There is no relaxation, even when they're not aware of it. That means that the cortisol is continuing to pump through the body and keeping the heart and blood pressure going too high when it shouldn't be. That results in a chronic state of stress, tense muscles, a rapid heartbeat, a state of hypervigilance. Even when the person may think he or she is calm, the body continues to pump that cortisol, keeping the blood pressure high and leaving the body vulnerable to being worn out. People end up having cardiac problems, high blood pressure, and autoimmune diseases. In your practice, have you ever worked with a client who kept watching the door, fearful that someone might break into the office? So the perception of incoming stimuli is also shaped by the state of your nervous system. When someone is hyper-aroused, an innocent smile may seem as a glare or a leer, when it's actually truly an innocent smile. So my experience with Virginia was, on my part, innocent and friendly, but she perceived it as being an attack, and she was defending herself, telling me to, you know what, to myself. I have to wonder if this may be what's going on in our police problem today, and that there's a difficulty with managing the stress response, and there's a lot of overreaction going on, and so something needs to be done to help train the police and others to control that reaction better. So how can that be done? The key is to elicit the parasympathetic nervous system. It automatically de-escalates the body systems that react to the stress response by bringing the body back to normal. It is the rest and digest response. And the vagus nerve is the major player. The vagus nerve is we're going to look at soon, but it brings 80% of the incoming information on the state of the body is going to the brain through the vagus nerve. So it's very much affected by breath practices. And this is what we need to learn how to use. Yoga has been very helpful to elicit the parasympathetic nervous system response. That is because yoga is movement with cognitive focus in synchrony with the breath, and it elicits the parasympathetic nervous system response. One of the major tenets is to honor the body, so you're listening to your body's messages. The idea is that yoga is there to serve you. You are not just there to serve it. It's not competitive, and it's self-focused. Anyone can practice yoga, just depending on the poses that are modified to their physical condition. Just a little note that is important is to not practice yoga on a full stomach. That it's much easier if your stomach has had at least 2 hours between a meal. It'll be better for you to move. So how do we elicit the parasympathetic nervous system response? The secret with yoga is the breath and coordination with the movement. And of course, focus on what you're doing. I call this IEEC, inhale, expand, exhale, contract. You may want to try this right now as you inhale, expanding your arms, exhale, contracting your arms. Inhale, reaching up, exhale, reaching down. So this asana pranayama square breathing will be shown on a video at the end of this presentation. But basically, you're making a square with your hand as you inhale, going up and across. You're pausing. Exhale, your square with your hand is going down, and then pause. Inhale up, pause, exhale down, pause. So at the end of this presentation, you will see these this particular flow of practice. With this practice, you can bring on the parasympathetic nervous system response. Compassion fatigue. Social workers are in need of self-care strategies to prevent compassion fatigue and burnout. It's very important to identify and address burnout if we want to prevent ethical violations. So regular yoga practice can be transformative and set us up for increased self-awareness and self-attunement and better self-regard, so we can take better care of ourselves. We all know that we perform our jobs better when we are refreshed, and mistakes happen when we are tired and worn out. So this is another reason for us to practice yoga. So what's going on physiologically? Let's look at the vagus nerve on the left. It's the 10th cranial nerve. It's located in the brain, and it travels through the brain stem. It starts out in the ear as well as in the throat, and then it goes to the heart, the lungs, liver, stomach, spleen, pancreas, large and small intestines, the rectum, the kidney, bladder, penis and scrotum, and ovaries and uterus. It goes throughout our body, and it's reporting, most of its information is reporting to the brain. It's coming up to the brain, telling the brain on the status of the body. It is toned by acetylcholine. We know that a flaccid vagus nerve is indicative of anxiety and depression. So the better tone it is, the better you're going to feel. And somehow the breath practices are doing something to release acetylcholine and GABA and have helped the tone of the vagus nerve. So there's a direct impact between the breath practices and the tone state of the vagus nerve. On the right-hand side is something that Bessel van der Kolk calls the mohawk of self-awareness. The areas of the brain that are self-sensing, that means they know what's going on in our body, are located mainly in the limbic area. The medial prefrontal cortex, the insula, anterior cingulate cortex. These are areas that are reporting to the mind what is going on within the body. And these are areas that are very active when we're in a yoga practice, as shown on fMRIs. So yoga seems to wake up and strengthen the mind-body connection. And the more often you do it, the stronger those connections get. Looking at back to the vagus nerve, if you the area that is around the liver, where that part of the in the body where that liver starts, that is called the dorsal vagal branch. Above that is the ventral vagal branch. The dorsal vagal, the lower part, is involved in something called the freeze and submit response. That freeze and submit response happens when trauma occurs in which the organism cannot flee, cannot fight. It shuts down as an escape. And we see this in human beings as dissociation. In animals, it's playing dead. So numbness and otherworldliness is the response to that, is the dorsal-vagal shutdown. It is a metabolic response. It's something that we share with little animals, like little mammals, like rabbits and reptiles. It is within our physiology. It has ancient evolutionary roots in the animal kingdom. So in the dorsal vagal shutdown, the digestive organs screech to a halt. In human beings, we may feel a visceral sense of dread, of gut-wrenching nausea, or even have diarrhea. It's very common with dissociation, with trauma. And people end up feeling numb or disconnected from their own feelings. So people may not even be in touch with their illness, ignore what's going on in their body. There's just no connection between the mind and the body. It's been severed, almost severed. But the antidote to this is to generate and facilitate interoception, the development of the mind-body communication. And interoception is something that's going on when you're practicing yoga. Honoring the body, looking for the body's messages to telling you what you should and shouldn't do. So developmental trauma with children is very complex. It affects the child's actual development, is skewed due to the trauma that has been impacted the child. It's a deep, persistent impact upon the child's growth and development. And results are a sense of powerlessness, a feeling that the world is unsafe, a feeling that people cannot be trusted, a feeling of shame and worthlessness, a feeling that sensory stimulation like sights and sounds and tastes and touch are dangerous. So there's a woman named Alison Rhodes who's done some studies on trauma survivors, and she spoke to one person, and this person put it this way: when you are abused, you feel small, even smaller than you are. That was my experience as a child. I wanted to be small and invisible, as invisible as possible. I wanted not to be seen, and I constricted my body, especially my back and my chest. So you may find from that constriction, people who have some breathing problems or some very underdeveloped rib intercostal muscles. They may be slouching all the time. They may be just caved in, looking very debilitated. And that is a defense that they have developed in relation to coping with trauma. What we've also seen in terms of traumatic experiences in childhood is that those people who have experienced such things as physical abuse, substance abuse, parental separation or divorce, sexual abuse, mental illness, emotional neglect, domestic violence, emotional abuse, physical neglect, and having a household member incarcerated, those areas are considered adverse childhood experiences and can be charted and seen to have a direct impact on a person's physical health when they grow up into adulthood. And what we have found is that 4 or more are very lethal. To have 4 or more adverse childhood experiences has led to really, at least to an early death, unless there's something that happens to really come in and reverse that process. And there are quite a few people who have experienced this. If you look at it, and this is 1998, almost a third of Americans had experienced physical abuse as children. And what people may be doing to calm down their nervous system is to use substances like drugs in order to cope, which then leads to other more dangerous behaviors and more serious health problems. As clinicians, as evaluators, we can look at child development through the lens of trauma and notice how it's affected attachment or biology, physical health, emotional regulation, and ability to focus, to be with it or to not be with it, to dissociate. We know, we've been knowing for a long time that behavior is impacted by trauma. Now we also see cognition and self-concept. So all these areas can be looked at through the lens of trauma. And this can be found on the internet. If you look at the bottom of this and you were to Google ja.cuyahogacounty.us, you can find this information. It's called Domains of Impairment in Children Exposed to Complex Trauma. So it would be a very good thing to have if you're doing any kind of evaluations or just alongside with you if you're working with someone and kind of looking at these issues from a trauma lens. What we have also found is that the brain is an association machine. There's the conditioned response, such as when you remember the story of Pavlov's dogs, who heard a bell and were presented with food, and then heard a bell and no food was presented, but they salivated. That bell was an association to eating. That's an association. That is where our brains work as well. And what we have found is that traumatic memories are embedded in neural pathways and memories, and they run from the brain to the body. These are neural pathways of learning that have learned trauma. So learned associations to trauma can be triggered by similar stimuli of the original insult. The mind-body reacts instinctively. This is where people get flashbacks from hearing certain sounds or smells. They will have an actual instinctual emotional response without even knowing how it got there. And that is because a neural pathway was activated. Perhaps it was dormant and then it was activated. And it's all happening outside the conscious awareness of the person. So it's an autonomic response. And this is the fight and flight or freeze and submit response may just kick in without even conscious awareness. These are due to neural pathways that have been set up and primed to learn trauma. And that's where our body comes in. The body doesn't forget. The body keeps the score. It remembers overwhelmingly negative experiences. They really make an impact and can get stuck in the perpetual fight and flight or freeze and submit response. Mental activity in self-sensing areas in the brain is suppressed. Those regions get less blood flow and that area gets smaller due to that. And that is what we're seeing on fMRIs. So this is where the intersection between trauma, stress, and pain occur. The common denominator between chronic stress and pain is the nervous system. Trauma can make the nervous system persistently reactive. And once an association has been made, an acute or painful injury occurs, an already reactive nervous system is more prone to develop chronic pain. We have seen this as well in veterans with PTSD, because they are also have been reported to develop more chronic pain. So what does prolonged stress do? It messes up the brain systems that want to return to homeostasis, to normalcy. With ongoing trauma, the nervous system gets stuck in a state of heightened reactivity, which we call central sensitization. The brain has been changed. The body's perceived pain tolerance threshold is much lower. And when this happens, the pain sensation can intensify so that what is normally not painful is felt as painful. Even a breeze blowing across your face or putting on a shirt can be experienced as pain. Pain is in the brain. Pain is also in the brain. It's not just in the body. And it's real. Central sensitization keeps the pain sensation going even after the initial injury or illness heals. So another method to elicit the parasympathetic nervous response in order to help deal with this condition is alternate nostril breathing, which will be shown at the end of this presentation. And it can be very effective in even lowering blood pressure for some people. So what has developed in terms of treating people with PTSD and chronic pain is trauma-sensitive yoga. And this is based on the work of Dave Emerson of the Justice Resource Institute in Boston. And he, with Bessel van der Kolk, came up with a program to help treat victims of domestic violence who were in a chronic state of pain and stress and emotional distress. Trauma-sensitive yoga applies understanding the science of trauma with the healing art of yoga practice. Its basis is that upon interoception. That is when you cultivate the mind and the body communication, where the mind notices the body's inner sensations, that the sense of the internal state of the body being relayed from the body into the self-sensing areas of the brain. A wonderful communication, a wonderful relationship develops. And this is where the healing can take place. So the insula of the brainstem, the thalamus, the somatosensory cortex, and the anterior cingulate cortex are all involved in terms of understanding and being more sensitive to what is going on in the body. So when that is cultivated, a new sense of self-regard, self-attunement, and self-harmony can start to grow. The other point of trauma-sensitive yoga is empowerment. And that is that people have a choice over their own bodies. A sense of selfhood that had been robbed is being replaced. So every movement that is made, and it's made with the client, you're not standing and talking to the client, you are doing it with the client. The client is given a choice whether they want to make that move or not. Sometimes the client is the teacher or is the leader and leads in the practice. It's very slow and very verbal. There's a lot of talking going on in trauma-sensitive yoga about becoming aware of what sensations you might be feeling in your body. So people with trauma are often disconnected from their bodies and from their inner sensations. Their self-sensing areas are turned off, and they're in a numb state of dissociation. It has been an adaptive defense mechanism. It had been the dorsal vagal shutdown. But once this continues, it becomes a problem because people are no longer able to feel joy, excitement, present, So you want to heal that dissociation. And that is where practicing yoga as a safe, nurturing experience cultivates being present and noticing your inner body sensations. And that mind-body relationship is the healing. So unlike typical yoga, like Iyengar yoga, there are no physical assists in trauma-sensitive yoga. There is no hands-on at all. And this is consistent with the NASW Code of Ethics, where there is no touching allowed. Everything is done with a verbal description or demonstration, and that seems to be very successful. It's not really necessary to have hands-on assists, although in traditional yoga practice and Iyengar yoga and such, coming out of India, physical assists are very common. However, in today's society, we're getting away from that. Certain poses are also not done in trauma-sensitive yoga, especially anything that might trigger a client to have a flashback. And so there are such poses like pelvic opening, poses like happy baby are not done because of the possible correlation with sexual abuse. So the practice is very much designed for the client, given their particular history and what they would need and not need. So we're going to talk a little bit about pain and stress studies here. And they're coming out of work from Wake Forest Medical School, as well as McGill University in Montreal, Canada. Applications of physical pain. So let's start with the definition of pain, types of pain. We begin with nociceptive pain, and that is normal pain that has been caused by an insult to your body. A broken bone, a laceration, a cut, even a paper cut is actual, something has assaulted the body and done something to the tissues. The skeleton, the organs, the smooth muscles have been injured. It's an actual physical injury. The next area is neurogenic pain. That's pain coming from the brain or the periphery nervous system, the neurons, the nerves. And that would be what we would call the phantom leg syndrome. So that the brain is sending information saying, I'm in pain. And that particular body part is in pain. Neuropathic pain comes from a lesion in the somatosensory nervous system, an actual physical lesion. So these are all physical reasons to have pain. Then there's an inflammation. The tissue is inflamed, inflammatory pain, such as rheumatoid arthritis, and that activates normal pain pathways. And finally, there's central nervous system pain, widespread pain that crosses categories like fibromyalgia. So how do we measure pain? Well, intensity on a 1 to 10 scale, 0 to 4 is mild, moderate is 5 to 6, and severe is 7 to 10. Over time, an acute pain lasts from 3 to 6 months duration, and chronic pain goes on more than 6 months, or after the tissue has healed. Acute on chronic pain is a flare-up superimposed on an underlying chronic pain condition. This is a brief review of electrical connectivity, in which the essence of thought, the essence of thinking, is a neurochemical electrical action in the brain. What happens is that neurons have chemical and electrical impulses that pass from the nucleus, which is on the right, along the axon, those little yellow boxes with the dots in the middle, into the dendrites, which are the tentacles that are coming out. And then the neurochemicals are released and cross the synaptic cleft, where the black stars are. And then they go into the next axon, and so on, and go down into the nucleus of the next cell. And this is a pathway. It becomes a pathway. The more thoughts, the more chemical electrical impulses traveling on the same path, the deeper and wider the neural pathway. So what this may look like, just an illustration, are a network of pathways going through the body, each one having its own memories or feelings, impulses, synapses. And the more frequently the thoughts pass along the axons, the deeper they become engraved into the brain structure. So pain sensations work similar to this. They may be connected to memories. As memories travel down neural pathways, pain sensations do as well. They may be activated. Physical pain and emotional pain travel the same pathways. So neural connections are like a road with traffic. The more frequently thoughts pass along the axons, the deeper they become engraved into the brain structure. It's like a path in the forest, which becomes deeper the more it's tread upon. Memories work in this way too. Memories also travel neural pathways. And thoughts can trigger a sensation. It's like a stimulus response conditioning, good old learning theory. The more you think about something, the more you're likely to remember it, especially painful experiences. Conversely, the less you think about it, the more likely you are to forget it. There's also a thinning and even a disappearing of neural pathways that are not used. It's called pruning in neurology. For example, if you think about academic loss that happens to children over the summer break, things that are not used, they tend to disappear. So if you apply this principle to pain and thoughts of pain and neural pathways, you'll start to understand that mechanism of neural pathway pain syndrome, which can possibly be unlearned. One thing to help manage pain as well is the thalamus. So if the neural pathways are the highway of the nerves that our thoughts travel on, the thalamus is the grand central station. It's the gatekeeper, all in one. As we've seen on fMRIs of neuroscientists, sensory input comes into the brain from the nerves and is sent to the thalamus to be processed and then to be interpreted. For example, that concept of vision. If you look at the optic nerve on the left, information coming in from the optic nerve of the eye to the thalamus goes to the thalamus, and then it's projected onto the visual cortex. And only then is it become vision. So if something were to happen to the visual cortex and it was destroyed or hurt in some way, vision could be impaired. Vision is a brain processing activity, and without the brain process, the activity cannot occur. And that is much like every other sensory information, including pain. So the thalamus can be a gatekeeper for processing pain. It can slow down incoming pain information from the body, resulting in pain being perceived less. If the thalamus doesn't register pain, the pain doesn't get processed and the person doesn't feel the sensation. So take, for example, a little boy on the playground. He falls down, he looks up, he sees his mother, and his mother's got a pained look on her face. And he starts to cry. And he runs to her for comfort. Then take that same little boy the next day, falling down on the ground on the playground, where his friends are playing on the jungle gym next to him. He looks at them, he gets right back up, and he joins his friends to play, ignoring the pain that he's just sustained. Well, how can that happen? Something in his brain is suppressing the pain sensation. So the thalamus has a huge role in whether pain is perceived or not. Here's an example. This is an experiment that was done by Zaidan, MD, at Wake Forest Medical School. He took 2 sets of people, young students. He trained one in mindful meditation for 4 days, 20 minutes a day. He trained the other in affirmations. He then placed the meditators into a fMRI and applied 120-degree Fahrenheit hot prods to their bodies and measured their reaction while they were meditating. And what they found was that compared to the non-meditators who also experienced the same thing, the unpleasantness of pain was reduced by 57% in the meditators. And the pain intensity was reduced by 40% in the meditators. So they were using mindfulness techniques to manage the pain. On the fMRIs, the thalamus was less reactive to the incoming pain. Another area is the anterior cingulate cortex also, and the right anterior insula were less active in the meditators. McGill University measured the size of the self-awareness regions of the brain in long-term meditators and yoga practitioners, and found that the size of their self-sensing areas in their brain was larger, as we had spoken about earlier. Now, this is very important in terms of brain atrophy, because with age, the brain, those areas do shrink, they get atrophied. And this was not the case with elderly people who had practiced yoga over their lifetime. Their brains were younger in the self-sensing areas. Their brain volume was larger than a normal elderly person. So Dr. Howard Schubiner has been a major player in this field for a number of years. And you would be advised to look at his work. It's on YouTube. If you were to Google, "The reign of pain lies mainly in the brain," he does a great job explaining this process, in which he calls neural pathway dysfunction and or mind-body syndrome. And the condition of lower back pain is one area that really tends to respond to the approaches. What he does is he first rules out nociceptive pain, anything that has an organic reason for occurring, and then does a very careful history and looks for possible ACEs, adverse childhood experiences, that could have caused this condition to have occurred. So a certain number of chronic pain sensations may be the product of learned traumatic experiences. So chronic pain and past trauma often co-occur, and they may manifest as fibromyalgia, low back pain, just to name a few maladies. Many trauma survivors experience an ongoing battle with their bodies. They are stuck in one of the stress responses of either hyper or hypoarousal, or alternating states of hypo and hyperarousal. We often see that in prison settings. The person may feel uncomfortable in their own skin, and there's a high degree of substance abuse for that very reason. So as clinicians, the goal is to find some way to help the client to rebalance the nervous system, to get out of the stress response, to elicit the parasympathetic nervous system response. Traumatized people often have trouble sensing what is going on in their bodies. They lack a nuanced response to frustration. They either react to stress by becoming spaced out or excessive anger. Bessel van der Kolk puts it this way: because traumatized people often have trouble sensing what is going on in their bodies, they lack a nuanced response to frustration. They either react to stress by becoming spaced out or with excessive anger. Whatever their response, they often can't tell what is upsetting them. This failure to be in touch with their bodies contributes to their well-documented lack of self-protection and high rates of re-victimization, and also to their remarkable difficulties feeling pleasure, sensuality, and having a sense of meaning. This is an interesting finding from a while ago, in which a back surgeon discovered that there was a very high rate of failure for back surgeries in people who have high ACE scores, basically. That the pain that they were experiencing in their back really was not coming from the back, but was really coming from the brain. And this article talks about that. And they talk about having 3 or more serious childhood psychological traumas as a risk factor to failure in the surgery. How can we manage this? What about switching in neural pathways? What about putting your mental focus on something and kind of distracting yourself away from that pain sensation? So to experience this, I just thought it would be interesting to look at this chalice, this orange goblet, and see if you can see another picture within this picture. You may possibly be seeing 2 faces. So you not only see a goblet, but also 2 faces. And what's happening here is that your brain is using 2 neural pathways, 2 perceptual pathways. So could it be possible that we can switch that pain pathway to another better pathway? Much like switching the tracks on a railroad. Perhaps when a person is in pain, mindful movement with breath can divert thought patterns away from pain activation, bringing the body into the healing process, aiding the cognitive strategies by focus and thoughts from one neural pathway to a better neural pathway, similar to switching railroad tracks. The breath practices are very helpful with this. The thalamus, the key player, is in process, and it can shut the gates of the incoming sensations. This parasympathetic system aids the process by the release of acetylcholine and toning the vagus nerve and setting up for a positive physiological process. So the healing that could possibly take place has often been called the placebo effect. But that is really, the placebo effect is the body using its own healing mechanisms that are inborn, endogenous, to heal. And in many cases, we found that yoga can increase the sense of well-being and reduce the sense of pain. And after all, it's exercise, which increases production of endorphins in the pituitary gland in the brain. So if you ever felt like you didn't feel well and you finally called the doctor, and as soon as you called the doctor, you began to feel better. This also may be a placebo effect, where the body gathers its own natural healing mechanisms. It's very much a mystery, but the goal is to harness the body's own natural healing life force and to propel it toward health. This is the basis of Eastern medicine, which has a lot to teach us. It allows the possibility of setting up a sublime circle. So we have exercise, which releases endorphins and makes you feel happier, more optimistic. You end up with being more fit physically. You may do more things. You feel better about yourself, which helps you be in a better mood. And then the pain is then decreased. So this is part of the concept of pain management, in which we're setting up a sublime cycle. The power of mind-body practices and techniques. So yoga practice can improve overall physical condition, and it can introduce the magic placebo effect. Yoga is a package deal. It elicits the parasympathetic nervous system. It helps the mind and the body communicate with each other. And it kicks in our resiliency and coping skills and enhances them. Osteoarthritis and rheumatoid arthritis have been greatly improved through practicing yoga regularly. There are many articles that have been written that describe improvement, especially for osteoarthritis in the knees. A regular yoga practice, 3 to 4 times a week, results in real physical changes. Motion is the lotion for the joints. The synovial fluid in the joints reduces friction. It's a shock absorber, and it lubricates the moving joints. During movement, the old synovial fluid held in the cartilage is squeezed out mechanically, and new fluid is generated, and it keeps a layer of new fluid on the cartilage surface, making it easier to move. Yoga is good for fascia. What is fascia? Fascia is a glutinous material between the skin and the muscles that lines our body cavities. It's 70% water, it forms our shape, and it lets the muscles glide over each other without friction. As you can see in chicken, on the left and on the right, this is fascia, the area that is shiny in the middle of just below the thumb. That is the fascia, the sticky membrane. Our fascia can get dried and lumpy. It responds to stretching and massage. Our fascia has nerves and blood vessels, and it can get inflamed. What we have found is foam rollers and a massage helps. There's a condition called myofasciitis that needs to be treated. So fascia forms a network of tissue throughout the body, like a webbing system. As I said, it restores water and fat. In part, it determines the shape of our body. It helps you move through space. It helps you feel your body in space. It's called proprioception. And with the lymph glands, it gets the fluids out of your body system. It's bound together in a three-dimensional matrix made of elastin and collagen and something called telocytes and fasciocytes. It shifts shapes and cushions blows. So the deep fascia is a dense connective tissue that is commonly arranged in sheets that form a stocking around the muscles and tendons beneath the superficial fascia. When you're engaging in a yoga practice, you're often stretching that area. And there's a yoga practice called Yin Yoga, whose major focus is to do deep muscle and fascia and tendon stretches. The plantar fascia under our feet is a thick connective tissue that supports the arch on the bottom of our foot. And sometimes it gets inflamed. We call that plantar fasciitis. Personally, I have found that yoga poses where you spread your toes and stretch your feet are very, very helpful for preventing this condition. And myofascial release is often done with a roller. If you can see the roller underneath the left thigh, that is how you massage the fascia either before or after exercise, and it is very beneficial to the fascia. So B.K.S. Iyengar put it this way in his book, Light on Yoga. Yoga teaches us to cure what need not be endured and to endure what cannot be cured. And I think this very much applies to the pain sensations and managing chronic pain. So as clinicians, how do we apply what we've just learned? How do we utilize mind-body techniques in clinical practice? I have come up with something called mindful movement with breath. This is not necessarily yoga, but it basically takes the principle of yoking the mind with the body. So it consists of simple, safe, everyday movements that you would normally do within a person's natural repertoire of activity. You look at the person's willingness to participate, as well as the person's physical ability. The goal is for the mind to focus on the movement as the body moves in synchrony with the breath. No fancy yoga poses are required. You may want to just take a look at getting up and down from a chair with focus and breath. Remember, you inhale as you expand and exhale as you contract. Come on in. Good morning, Goldie. How's your day going so far?
It sucks.
Your day sucks so far. What's happening? What's going on?
Well, I went to the parole board today.
You went to the parole board, okay, yes.
They gave me another 6 months.
6 months?
Yeah, all I did was pass out a little marijuana.
Yeah.
It's a big deal compared to other people.
Yeah.
I mean, but they were minors, but still.
All right. It's
Not your day is not going too well right now. All right. Let's see if we can try something to just get through the day here. Maybe make you feel a little bit better. You don't have to do it. But I'd like to invite you to try some body work here. And just watch what I'm doing if you like, and just see if you can want to try it with me here. Just before we sit down, we'll get you a little bit settled a little bit.
Whatever.
Okay, all right. So we call this washing machine. Just let your arms go where they want to go. Just side to side. If you want to get your foot and hips into it a little bit, get a little bit more oomph, you raise your heel, and then we can actually start to climb the
I'm
ropes.
still angry.
Yeah, I don't blame you. Oh, what a bummer. And I'm reaching up. My arms are reaching, and we're reaching for the sky. Okay. And now, just see if you can slow it down. Really stretch as you do it, and as you go up, you breathe, and then breathe again.
This is silly.
And it is silly, but let's see if we can spread our arms out to the sides like a T, and then forward. Just come over side, over to the floor as far as is comfortable, and then we're going to bring our arms together and just ragdoll, hanging. You can go side to side. Just breathe as you go. Breathing. Inhale and out. When you're ready, we're just going to bend slowly forward. Bring your arms down and bending our knees as we raise our torso up. And gazing forward, bringing our arms up into forward. Reaching with your arms. Reaching. Yeah, it's stupid. It is stupid. It is reaching. You want to gaze up forward. That's it. The gaze forward. See if you can look up. See if you can straighten your back a little bit. That's it. See if you can reach, as if you're reaching for a gift. Would you kind of bring your arms up a little bit higher? That's it. Looking forward. All right. Okay. Let's see what we can do here. Keep going.
Keep going.
You stay there. That's right. Okay. All right. I've got a chair for you behind you. Do you feel like you can get into it? That's it. Lower yourself. That's it. All right. And then you can
put my arms down.
You can put your arms down, and then let's reach forward. Let's keep going though. Let's keep going back down, a little bit forward and down. And just reach to our toes. Inhale and exhale. Come back up. Inhale. And then peek over your shoulder. Just peek over your left shoulder as you exhale. Inhale. Come back to center. And peek over your right shoulder. And then as you exhale.
You expecting someone?
Inhale deeply. And exhale as you peek over your left shoulder. Center, and look, and let's take our hands and bring them up to our shoulders and just make those circles with the elbows. That's right. Round, come forward. That's it. That's it, Goldie. Yeah. And then you can go the other way. middle fingers. Inhale. Put our hands to the base of our neck. Inhale. And then exhale and kind of bring them to the front of our sternum. Come back again. Inhale. And come back down as you exhale. And last time. Inhale. Come back up. And then down and so, you want to talk about it?
Do I have to?
Not unless you want to. You can do anything you want right now. This is your time. If you want to just breathe, noticing your breath.
I can't say that didn't feel better than how I was feeling.
All right. I know, yeah, but
6 more months.
6 more months. I know, 6 months. I'm sorry to hear that. That's disappointing. Very disappointing. I was hoping for you. Oh, let's just keep breathing.
All right, well,
All right, Goldie.
are we done?
We're done.
Okay. Wasn't that bad.
Mindful movement with breath is based on the yogic principle of yoking bodily movement with synchronized breath and focused thinking. It's yoking the body with the mind, but not to be confused with yoga. The difference is that mindful movement with breath can be adopted to any bodily movement, especially movement found in a person's typical daily routine. No specialized movements are required. For example, prone stretching that might be done upon waking from sleep can become mindful movement with breath when done intentionally and in synchrony with inhaling and exhaling. The technique for mindful movement with breath is simply, as we remember, to expand your muscles as you stretch on the inhale and contract your muscles as you return to neutral on the exhale. So to apply this information that we've been learning with a client who might be hyper-aroused, you would start by large muscle movements like marching, possibly with breath awareness, and then going toward more calming activities and generating more challenging moves, such as hovering over a chair with breath awareness, and then standing still, again with breath awareness. So if you had a dissociated person who is perhaps hypo-aroused or depressed, you might start with a continual, gentle lifeline of statements, adding movement gradually, starting with perhaps a body scan and breath awareness, and then moving into gentle arm movements, and then on the way to sitting to standing movements. So you're going toward a more energetic and increased energy as time goes on. And finally, in standing, if you place your hands on your hips with shoulders back and down, it creates a sense of confidence. One tricky thing to remember is that breathing techniques need to be introduced gradually, little by little, adding just a little bit of breath and watching your client's response before graduating into deeper breaths. And that is because deep breathing can possibly be triggering. So you really have to know your client and experiment to see how they handle their breath awareness. The goal of mindful movement with breath is interoception, developing awareness and a relationship between the conscious mind and the body. And that is where the healing takes place. Where do we go from here? Well, I would suggest to begin with researching mindful movement with breath techniques to address different nervous system states. That would be in the areas of mind-body studies, such as somatic psychotherapy, yoga, perhaps trauma-sensitive yoga. And then to try it for yourself, to practice mindful movement with breath or yoga or other mind-body techniques that you understand firsthand what it's like. And if you are so inclined, to advocate for the social work education system to begin to train young social workers on the mind-body studies, as well as to advocate with the American Social Work Board, the Council on Social Work Education, and the National Association of Social Workers. The big takeaway is that those of us helping trauma survivors need to bring the body into the healing milieu. We must address the ways that trauma is held in the body in order to make the healing process more complete.
Hi, we're going to do some yogic breath practices. First, we're going to start with square breathing. We're going to make a square in the air. And on the up side of the square, we're going to inhale. Inhale. Pause. Exhale. Pause. Inhale. Pause. Exhale. Pause. Inhale. Pause. Exhale. Pause. And now we're just going to do it without the square, imagining the square now. Inhale. Exhale. Inhale. And exhale. This is a go-to breath whenever you're feeling stressed and you want to calm down. The next thing we're going to do are restorative arms. We're going to bring our fingers to our shoulders and make circles with our elbows, clockwise and then counterclockwise. Now combine the breath, the square breathing. Inhale, exhale. Last time, inhale, you can slow down and exhale. We're going to do arm massages, crossing the wrists and bringing the fingers to the shoulders. You're going to inhale and exhale as you squeeze gently and come down the arms, all the way down to the forearms, to the wrists, and then come back up. Inhaling on the way up, and then exhaling on the way down. And do that for 3 to 4 times in your own time. We're going to do elbow lifts, bringing the palms together and the elbows together, and inhaling. Inhale and go up. Exhale down. Inhale up. Exhale down. Inhale up. And exhale down. And now just shake it out. And that's that. And now we're going to do Nadi Shodhana, alternate nostril breathing. You take your two middle fingers and place them between your eyes and then above, right in the middle of your forehead. Not too high, just above your eyebrows. You're going to take your ring finger and your thumb and alternate breathing in and out with your nostrils. I will demonstrate. I inhale. I cover my right nostril with my right thumb, and then I exhale out of my left nostril. I inhale left, raise my thumb, take my ring finger, close off my left nostril, exhale out of my right nostril. Inhale. Close off my right nostril with my thumb, exhale out of my left nostril. Inhale left, switch, exhale right. Inhale right, switch, exhale left. Inhale left, switch, exhale right. And so on. You can do this faster. And that is Nadi Shodhana, alternate nostril breathing. It's known to bring down blood pressure and be very relaxing. So I hope you try these.
To summarize, the main ideas are that the body and the mind are one organism. We call it the body-mind or the mind-body, but both terms are the same thing. And in order for social workers to be more effective in delivering services to the whole person and environment, we need to understand and address the mind-body, which at a minimum entails the following: understanding the three-part brain, especially the emotional brain, and understanding the neurophysiology of both the stress and relaxation responses. That means understanding how the sympathetic and the parasympathetic nervous systems work. The second is that pain sensation is a mind-body experience, with the brain having a major role in perceiving pain. That is to say, the brain has a role in making pain seem worse or seem manageable. Third, chronic pain in some cases is a learned condition response associated with emotions that are triggered by neural networks and neurochemical processes. This happens because learned experiences create nerve networks that connect between the brain and the body. Traumatic memories are stored in those neural networks and may lay dormant until certain stimuli that reminds them of the traumatic memories trigger the nerve networks to become active. A little bit like an immune system and how our immune systems work. Take, for example, a man meets a woman who has similar facial characteristics as his ex-wife. During the time of the divorce, he had had a back injury that has since resolved. However, now he sees this new woman and immediately feels the old back pain again. That pain was being triggered by the past traumatic emotional memories. The theory is that people who have had past trauma will be more vulnerable to chronic pain. Chronic stress in people with past trauma can also stimulate chronic pain. And that's because the continuous release of stress neurochemicals can trigger the pre-existing nerve networks. So what's the antidote to this? What is the antidote to this vicious cycle? Regular activities that elicit the relaxation response, that elicit the parasympathetic nervous system. in order to allow the overactive neural networks to calm down and possibly heal through disuse. So activities such as yoga, mind-body movement with breath, qigong, tai chi, even singing in a choir or singing with other people is a way to elicit the parasympathetic nervous system. Regular exercise helps quite a bit. The point is it has to be a regular activity, at least 3 times a week minimum, in order to have an effect. So what can we do for our own self-care? And that is we need to be really alert to and honor our own internal nervous system states. Be aware when we're under stress and we need a break, and take the break. We need to use our breath to control our reactions to stress and pain by learning how to engage our parasympathetic nervous system through mindful movement with breath or other mind-body activities. And it's also good to prepare for challenges by taking good care of that mind-body on a daily basis, using good health practices, getting good nutrition, getting enough rest and sleep, getting regular exercise, getting regular socialization, and having opportunities for mindfulness and meditation. So in order to experience a little bit of a body scan and to facilitate meditation, I'd like you to engage in this little yoga nidra. Take a deep breath, and if you'd like, you may shut down your eyes. Bring your awareness to your toes and tell yourself, I release my toes. Bring your awareness to your feet and tell yourself, I release my feet. Bring your awareness to your shins and tell yourself, I release my shins. Bring your awareness to your knees and tell yourself, I release my knees. Bring awareness to your thighs and tell yourself, I release my thighs. Bring awareness to your hips and tell yourself, I release my hips. Bring awareness to your belly and tell yourself, I release my belly. Bring awareness to your chest and tell yourself, I release my chest. Bring awareness to your shoulders and arms and hands and fingers and tell yourself, I release my shoulders, my arms, my hands, and my fingers. Bring an awareness to your neck and tell yourself, I release my neck. Bring awareness to your chin and tell yourself, I release my chin. Bring awareness to your lips, your tongue, your teeth, and tell yourself, I release my lips, my tongue, my teeth. Bring awareness to your nose and tell yourself, I release my nose. Bring awareness to your eyes and tell yourself, I release my eyes and their sockets. Bring awareness to your forehead and tell yourself, I release my forehead. Bring awareness to the crown of your head and tell yourself, I release. I am released. Thank yourself for coming to this presentation today and opening yourself up to learning about your own health and wellness and that of the people that we serve. And gratitude for all the preconditions that allow us to come and learn today. The light in me sees and honors the light in you. Namaste.